Welcome to the Help We Need podcast, where we explore topics that empower women and support their well-being. I'm your host, Fumike Keji, and today we are continuing with the part 2 series of our episode on women reproductive healthcare, with focus on ovarian reserve and the IVF procedure. In part 1, we spoke in detail about the ovarian reserve, the process, its pros and cons, and some nuggets of advice on cost considerations for the process. That session was very, very educational. I would recommend you to tune in and listen to it if you're yet to do so. So today, once again, we have our very special guest, Dr. Martha Duque, and she's with us once again. Yay! So as a reminder, she's a licensed IVF fertility consultant with over 15 years of experience and a practicing consultant on women's reproductive health care at First IV Clinic. Welcome, Dr. Mata. Thank you so much for joining us on part 2 of our episode on women reproductive health care. Today, of course, we will be focusing on the IVF procedure. So it's such a pleasure to have you here with us today.
Thank you so much again. Again, a lovely experience to carry on talking about fertility, which is my passion in life. I'm an OB/GYN doctor, but to be honest, since the moment I discovered fertility, this is my passion, so happy to be here with you.
Thank you, and obviously we're so honored to have you here again today. So let's move on. So we've talked about ovarian reserve. I think today we're focusing obviously on IVF procedure, and my question obviously is quite predictable. So what is IVF? What does that mean?
So IVF at the end is one of the options when we talk about fertility treatments. And IVF means that we are gonna get some eggs from the ovary. We'll try to fertilize them with the sperm outside in the lab, so we can create or we can have embryos already. Once we have the embryos, we can do, or we have different tools then to do the treatment more efficient. But at the end, we have the embryos. And this is what we are going to transfer back inside the uterus. It's already the embryos. So at the end, egg freezing is like the first part of IVF. Obviously, when a lady is going to freeze eggs, she's going to do it just in case in future she needs to do IVF. And when we do IVF, the main or the most important factors in terms of prognosis are going to be female age and how many eggs we are going to have to work with. So obviously, the younger we are and the more eggs that we have, with a little bit of common sense, the better results we are going to have. So at the end, when a lady is doing egg freezing, it's like if she's starting the IVF process, but will stop at the moment we collect the eggs. Then let's see in future if she needs to finish the treatment or not. Most of them, they will not need to do it. But IVF is already for couples that they are trying to have a baby. It's not happening, so they have a fertility issue. These days also, we do it directly for couples that there is a genetic disease on the family, for example, that we want to make sure that their children, they are not going to have the disease. so we can test the embryos for that disease. So IVF is like the second part for egg freezing. So it's already
Okay.
to finish the treatment, let's say.
Okay. And for those of us listening in, obviously from a definition standpoint, IVF is in vitro fertilization. And as we've had
Exactly.
Dr. Marta say, yes, obviously it's a treatment for infertility when a woman is unable to get pregnant, and it's, you know, most times the first option for couples that are really trying to conceive or have a baby. And she's just giving us some perspective in terms of part one, where we explore the ovarian reserve a bit more. So it's more or less just giving us that insight and helping us have that foundation for us to build on. And thank you, Dr. Marta. I like you said, the eggs are being collected, they've been frozen, and then obviously once they're retrieved, they would need to be fertilized. So would you help us expand a bit on our understanding? So let's say, for example, a couple have come to you and I don't know what you do, but could you just walk us through the process of maybe helping them understand when to use IVF, and if that is something that is realistic for them as a couple?
So first of all, when does a couple need to come to a fertility clinic? Based on the book, let's say we define infertility when a couple has been trying for a year and pregnancy doesn't happen. That applies usually or mainly for couples where the female is 35 or younger. Okay, the moment we are 35, we recommend a shorter period of time, maximum 6 months. And if it doesn't happen, come to a fertility clinic. The moment we are 40 years old, even earlier than that. But that doesn't mean you have to wait. So if you are really stressed, I mean, I don't know, you are 33 years old, you have already been trying 6 months and pregnancy didn't happen and you feel really stressed, okay, come, we'll check, we'll see where we are. So it's not like black or white. Most of the times we are gonna be in the gray zone. Okay? And basically once the couple comes to us, we do the fertility assessment, which is quite simple and will give us a lot of information. Basically, on the female side, we are going to do one ultrasound and blood test. Ultrasound will give us an idea that there is nothing structural, anatomically, that is disturbing or reducing the chances for a lady to get pregnant, and will assess the ovarian reserve. Blood test, also to check the ovarian reserve with your anti-Mullerian hormone, and just few more things that are related to fertility and that we need to have in the normal range to be in the best situation possible. Your thyroid, vitamin D, few things depending on, everyone is different. So for the lady, ultrasound and blood test, easy. Male side, we just only start with a sperm sample. With that information, all these results, based on female age, how long they've been trying. Most of the times we can already do a fertility treatment plan. We can give them advice, but it's very difficult. It's always very different from one couple to another. Many times we have a couple and they end up telling us, no, but my friend came to you or to another clinic and she's gonna do that. Yeah, it depends. Every couple is different. depending on their situation, age, how long they've been trying. Why IVF is more and more and more and more the treatment that we recommend most of the times, because many times will let us help you to have the first baby, but also to keep more embryos so you can have an opportunity to have a second, even a third child. So it's the only treatment that will let us at least try to help you with your family fertility plan, not only to help you with one child, but as a family, because most of the couples, they will like to have two at least, sometimes even 3 kids. And it's the only way we can do that. Because if not, always remember, age, ovarian reserve, age, ovarian reserve. And if you get pregnant, obviously you are not gonna come back to us until another year and a half at least. Pregnancy, delivery, 3-4 months at least. So that means a year and a half, most of the times at least, that you will be older and your ovarian reserve will be lower. So this is always the message.
Thank you. That's really helpful. I love the way you explained it, that the women will come, they will do the ultrasound, they'll do the blood test, and the men also would have their sperms or semen tested as well. So it's a couple thing. It's not just about the woman. And I know there's that mentality that when it
Yes.
comes to infertility, or maybe when women want to get pregnant, it's all about the women. But what I hear you say, it's both couples, it's a unified goal. Both couples need to come, they need to be tested, and from that angle, you're able to provide the best advice that is helpful for their family situation. So thank you for providing that perspective. I think it really helps. I'm just thinking through this now. I mean, obviously, for a couple to come to you, they've been trying, and it's not yielding results. So I can imagine they're emotionally stressed, even maybe psychologically as well. They are not in the right frame of mind. How does this, in your practice, how have you supported couples during this process? Because it seems like it's very, I don't want to use the word intense, but it's nerve-wracking, right? This is an emotional situation. Yeah, so how do you support couples through this process, if you do?
It is. I think the first thing you need to do is to make them understand that you support them, you understand them, that this is very important for them. At the end, the family plan, having kids, is going to be the most important thing you are going to do in your life, or at least for most people. If you ask them at the end of the life, what is the important things in your life? Most of us, we are going to say our family, our kids, is what it is. I don't think anybody will say, no, it's the car I bought when I was 30 years old. No. Okay. So at the end, this is the most important thing. So they usually come like not sure that we are going to understand them. And we do. Second, we have to completely help them to forget the word guilt. There is no guilty on this. There is no responsibility. It's not on you. So yeah, we might have a problem with the sperm. We might have a problem with your tubes. But that then is what it is. At the end, it's still a couple thing. I don't, it's very important trying to leave that apart from the equation, because otherwise it's gonna be a really tough thing on a couple. And I've seen a lot of couples breaking up because they start, like, throwing these things to each other. So if you don't have a really good foundation as a couple, this can be a very stressful situation that can make you break up, because you use it as a part of the war, let's say. So yeah, it's a very emotional and intense situation, but not the treatment itself. It's not the ultrasounds, it's not the blood test, it's not the injections, it's not the egg collection. That's not the difficult part. And you can ask most of the ladies, they have done IVF, and if you ask them for the whole process, what is the most difficult part of it? And I would say most of them, they are going to tell you the most difficult part of the treatment is the moment we do the embryo transfer. We have to wait 8, 9, 10 days to do the pregnancy test to see the result. And there is nothing else you can do. There is nothing else we can do. We all have to wait just to give it time to see the result. This is the really difficult part. And obviously, if we end up having a negative result, it's difficult. They invest a lot emotionally, financially, and they cannot control anything. So that's why trust the clinic and the doctor and the embryologist and the nurses that they are trying to help you is so, so, so important. So if you don't trust the clinic, if you don't trust the team, it's gonna be better just try to find another option for you, because this is so important. And this is always a teamwork. Patient, doctor, nurses, receptionists, everyone is part of the team.
This is very enlightening, and I like the fact that you talked about having a strong foundation, and that comes with understanding, especially when it comes to couples, that it's no fault of theirs. You've highlighted that, and we're coming together as a team and working together as a team and trusting yourself, the doctors, whoever is in charge of their treatment. And so that's really very important to call that out. There is no blame game here. It's just focusing on the point and the objective of coming to the clinic and having those treatments provided. And I think the psychological part of it as well is also crucial, because if the couples are calm, obviously their body will respond accordingly. So I think it's helpful for couples to maybe leverage other support networks as they go through this process, to provide them with a base for them to thrive and hang in there and be strengthened maybe by other people's stories as well. So if you're listening in, it might be helpful to look out for support groups or networks online. They're also going through the process, and just listen to the examples and listen to their stories. I think coming together as the community gives it's a support system on its own. So thank you so much for sharing that, and I think that's really a very vital point that we need to take into consideration for this treatment as well. So I know, at least in our side of the world, there are certain, I don't want to say ECOPs, but it acts like ECOPs, right? Like religious, moral restrictions that kind of restrain people from embracing this whole procedure of egg freezing, or even if we're ready now, we need to do it, undertaking the IVF procedure. What would you say to listeners that are still hanging between maybe their religious or moral restrictions, and they're looking to have a child and grow their family and can't do that naturally? What piece of advice would you have for this couple?
Fortunately, we live here in Dubai. That is a very, very open, multicultural, multi-religious place. Yeah, and it's a Muslim country, but I mean, some other religions, we are also here. And most of them, most of the religions, or I would say all of them, they are open. They are open to fertility treatments because they see it like another tool from the medicine. So if you are diabetic, you need insulin. If you need, you have a cardiac problem, you will solve it. So yeah, you have a difficulty in your fertility, you can look for help. But at the end of the day, if any couple has any kind of doubt based on whatever they need from us, we always tell them, go discuss it with your religious counselor. And at the end, you will decide what you want to do. But to be honest, it's very rare that we have couples in that situation. That, yeah, most of the times they already understand what is IVF, what is fertility treatments, and it's fine, they are fine. Because at the end of the day, it's just to help them to have kids, and this is always a blessing in every religion to have kids.
Absolutely. I think we're completely aligned on that. And I like the way you put it. You have an headache, you use paracetamol. I mean, I'm just paraphrasing. You have a medical condition, you go see the doctor, they'll use whatever tools are necessary. And we can look at that from this perspective as well. It's a tool to support us in growing our family. So if there's people listening in on the call and this seems to be like a showstopper, at least knowledge is empowering. It might be helpful for women and their partners or husbands to at least have an understanding of what this procedure does for them, and then consult with maybe their religious leaders. But at the end of the day, the decision, the choices is theirs for them to make, and they would need to work with what works best for them. So thank you so much for providing that perspective. And just moving on, now moving on to the ethical considerations, because there are a number of ethical considerations in fertility treatment. You mentioned that previously, that sometimes could act as a showstopper as well, and could also boost the process. Could you maybe kindly walk us through some of these considerations that people may be aware of?
I didn't understand you, Mick, exactly
Okay,
about.
so just, yeah, so there are ethical considerations in
Yes.
fertility treatments, and these considerations are obviously multifaceted because we are in a global world. One thing that maybe I could lean on to would be, for example, limit to access for even the fertility treatment, because some nations are well advanced than others, in a sense, and maybe that could be a bit of a restricting factor because they don't know that this is an option, or they don't even have the facility to provide a remedy. So this is an option that could be an ethical consideration impacting the treatment that you've just been talking to us about. So it's just me trying to get from you what other ethical considerations could we be mindful of, maybe in terms of risk, maybe even in terms of walking through what is essential for the patients to know, even as you take them through this process, consent, like those things that maybe could be impacting the process itself, but you need to follow certain steps to do. And just share with us, maybe from your perspective, what things that you take into consideration to make sure that this is ethically done and maybe done in line with, I don't know, the laws of the country, the process that you need to follow, because you can't just do anything. They need to follow certain steps.
Exactly.
So something
Yeah.
like this, if that makes sense.
Yeah. So exactly. Obviously, the first step that we need to respect is the law. The law regarding fertility treatment is different from one country to another. So can be different, the treatment options available. For example, egg donation, sperm donation can be legal in some countries. Some other countries is not going to be an option. So the first step is the law. What the law is going to let you do or not. And second, obviously, is ethics. And a word that I love it, and I always say it, and is common sense. Common sense, that's many, many times is the less common one. So at the end is common sense. And be honest. What do I mean? It means, for example, if I have a patient 48 years old coming to me, asking me for advice, what are my chances? I have to be honest, and I have to tell her, look, with your own eggs, it's gonna be really, really, really extremely difficult to get you, to be able to help you. Our chances to end up having a baby are gonna be less than 1%, 1% maximum, being generous. So we have to be honest about what a couples can expect from us. I don't like when we have colleagues that they will tell every single couple, don't worry, I'm gonna help you, don't worry, I'm gonna help you. I'm gonna help you as long as you are aware what we can expect. And I think this is the most important part, because at the end of the day, a couple is gonna do a big effort. As we said before, emotionally, financially, so they really need to know exactly where we are. For me, this is the most important thing, because obviously patient safety, following the guidelines in terms of preventing infection, this is like, I mean, we shouldn't even be discussing that. This is like, I'm on.
It's part of the process, it's what you have to do.
Is there.
Absolutely.
No matter if you are doing fertility treatment or you are going to remove a tooth, I don't know, is at the basics. So
good.
It's like,
yeah, this is
is
good.
there.
It's good to know. So yeah, people need to understand that there would be some documentations, processes in place, so you don't just go in and walk out. You might need to sign certain papers. You might need to consent to the process, depending
Obviously,
again on
obviously.
all
And
this. Yeah,
sometimes even, I mean, this is about helping you to have the healthiest baby possible, keeping in mind the tools that we have. But also we need to think about you as a mother. We want you there.
mhm,
So sometimes there is a medical condition that pregnancy is contraindicated.
mm,
And we have to tell the patient, look, it's not ethically that I will try to help you to get pregnant because it's very risky. You are risking your own life if you go ahead, if we get you pregnant. Obviously, this is very rare these days. Has to be something like really, really big, you know? Or if you get pregnant, you have this medical condition that can get worse. These are the risks. We are gonna, if you would get pregnant, the risk for you to have any kind of complication during the pregnancy are gonna be higher than a lady that doesn't have this medical condition. So it's always about informing and making decisions together. Is it a sensible risk or is a very high risk? So
this is good to know, and obviously people understand that there is a guideline towards even practicing. And sometimes what I can hear from you is that sometimes you may not be able to go ahead if the risk is really high, and you would be able to provide that advice to patients as well. So they have that overview of what is ethically correct and maybe not, depending on their circumstances. So probably this
exactly.
moves me to my next question, because you've talked about legal considerations a lot. And I know for some people trying, there are other options, right? So even if they cannot together, even with the tools you've just explained to us, they still cannot go into that process where the woman is able to get pregnant and they build their family. It appears from a legal standpoint, it supports certain options. And I'll explain what I mean. For example, we have surrogacy, and I know it's common in certain countries, maybe not all countries. You have the option of egg and sperm donation. There's this thing I heard about posthumous reproduction. So somebody's deceased, but you know, their sperm or their eggs can be used. And there's this adoption, embryo adoption or whatever. So in terms of those other options, for example, if the couple comes to you and it's so obvious that even with the IVF, it's not going to work, are you in the position to still support them with other options, maybe just guidance, and then they can take the next steps in terms of exploring further if that's what they want to do? Um, how does that look like in that scenario?
I mean, you can give information in terms of, look, these are your chances if we do IVF. You have some other options that they are not available in this particular country. It's up to them. It's up to them. I mean, these days it's very easy to have information because all clinics around the world will have online consultations and it's easy to get information so you can make decisions about what you want to do. But we don't, I will never enter giving the details about a particular treatment I cannot offer.
Okay. But at least people know that it's there. Most likely, if they explore further and they can maybe then recommend legal support. I know in certain areas, or maybe even some news that we hear where you have celebrities having babies through a surrogate, so a woman that carries the child on their behalf. I know people are open to this information, but at least it's still good to have that conversation here so they know that's an option and they could explore further. But whether it's a surrogacy alternative or you need to explore the option of, do you need to have maybe go further into the egg or sperm donation process, if that's something you're exploring? Those are things that probably need to be done in consultation with a legal person. But like Dr. Marta has said, I mean, this is what they do. And if you ask for options, they may not be so prone to go further because they're limited maybe by their own support. But it's helpful to know that it's there. And if you want to explore, you could do that. But this type of scenarios would involve that maybe getting legal person as well, at least in some jurisdictions, to be able to move on with that process. So thank you so much, Dr. Mata, for providing your perspective. So just moving on, I'm now zoning in on the success stories because I think this could be a game changer. And if you could share with us what success stories do you have that could sort of encourage our listeners, I think that would really be helpful.
I don't know. I think we have successful stories nearly every day, thank goodness. At the end, every single couple that we managed to end up having a baby, to help them to have their dream, to achieve their dream, is a successful story. No matter if it was easy from the medical point of view or more difficult. For every couple, it's going to be difficult because they struggle to be in that situation already. So, but obviously we have cases that they are here in our heart, let's say. I don't know. I remember cases like, I don't know, they are so sweet that they will be in my heart forever. I don't know. I remember a lady that came to me with major depression because she was already 41 years old when she came into my room. And she has a history already of infertility. And it took her like 5-6 cycles to get pregnant. And she ended up having a baby who unfortunately was diagnosed with cancer when was like a baby, and with a fatal end. So the baby died, and she came to me when just like 2-3 months after that, because he was aware about age, blah blah blah. She was still mourning. She was still crying for her baby. And we worked like 1.5 years working to collect eggs so we can have more embryos, because we were aware of the situation based on her age and ovarian reserve. And we end up having normal embryos, and she got pregnant. And it was a very, emotional situation for all of us, because it was a really difficult situation for her. I don't know, we can tell you from that story to another one that she couldn't have intercourse. She suffered from vaginism, which can have a big toll in a couple. But even if they could not have intercourse, they were such a sweet couple. You could see they were a nice couple. And at the end of the process, we were able even to place the speculum, to do any kind of fertility procedures. And it was a change on her life because we managed to help them to have a baby. But honestly, I think it was also a work on her side that she ended up being able to have intercourse, which is at the end very important for a couple also. So I don't know, so many. I don't know. I think every couple is a successful story. Sometimes
It's the
even if we
stories you
cannot help them. But if you try to make the experience as good as possible for them, that at least they leave the clinic with the feeling that they tried their best, is already something.
Thank you. Even for the success stories you've shared, it's liberating, it's engaging, it's empowering. And it just shows the depth and the breadth of the cases that you handle. So, obviously not one size fits all, but there's the possibility. And just having an open mind could even make the process more fulfilling. So I do have this kind of question that I just wanted to narrow down as to when couples come to you, maybe just really bothered that it didn't go the way they intended. And I know previously we talked about this and you gave me some analogies, like it's like playing cards. Do you want to walk us through that example again? Because I felt like it was really very refreshing. The way you explained it, that, you may not really have all the answers, but you said people should still give it the opportunity and try, at least try, so they know that they did their best. So just if you could help us walk through that analogy you gave me the other time, because it was really very lifting.
I don't know. Every time we do IVF, obviously, if we have a happy end, we don't usually look back about how the treatment went because we have the baby, so everyone is happy. Okay? When it doesn't work, obviously IVF treatment will give us a lot of information also. And that's the moment we sit down with the couple and we go through the cycle with them and tell them, look, yes, we checked your ovarian reserve beforehand and it looked that way. But now we have had the opportunity to have your eggs outside, to see them, to see if the sperm was able to fertilize them, if those embryos, how they develop, if there is no way to have nice embryos. So it will give us a lot of information for future treatments, if it's worth it still to try, if there is a still place to trying to improve things. There is always space to improve, obviously, like anything in life. So it's always like a positive, critical approach. At least this is the way I try to do it. Look, this is a meeting trying to do a positive, critical approach, trying to see if there is something different we can do next time, trying to have a different result. Or look, this looks this way, maybe you should consider another option. But obviously every time we sit down with them and at the end of the day, usually really helps couples to feel more relieved. If you tell them because there is a space to improve, because there is something else we can do. And if not, because we try to make them feel that, as we said before, no guilt, and you try your best. So if you try your best, what can you do? I mean, this is like sports, no? If you really try your best during a match and still you don't win, what are you gonna do? You did your best.
Not to beat yourself down, not to nosedive, but at least you made an attempt and you did your best. It's better than not doing
Right.
anything. And I feel like this is really lifting. So try. At least you tried, and it's not all bad. So going in with an open mind, being positive, trusting the doctors and the nurses that are helping, looking for community to support you as you go through the process. For some of us who are of the faith, trusting in prayer, but obviously acting out by doing what we need to do in our own best possible way, and then just
Exactly.
leaving the process to play out on its own. So thank you so much,
And
Dr.
I don't
Martha.
want to sound
This
like
insight,
that. The positive thing is that I want them to understand that we managed to help most of the couples. And when I say
sure.
most, maybe around 85% of the couples that they start the treatment, we will manage to help them. Maybe not with the first attempt, but
Mm,
at the end of the day, sooner, later, this way, or plan A, plan B, we'll see. But we manage to help them.
Thank you, and it's good that you called that out. Maybe not with the first attempt. So not giving up and pressing in and persevering. It's part of the process. It may not be the
Yes.
first time, it could be the second, it could be the third time. So I like the fact that you're giving us an open mind here. There are no promises, so we don't give expectations that cannot be met, but having an open mind and then working together with the patients to achieve the goal that they've come to you for. And that's absolutely wonderful. It's good to just let's have an open mind and let they work together with you as well. So thank you so much. I believe these insights are really life-changing. I trust that our listeners feel the same and that they're empowering. And I would encourage our listeners, as you've done so many times on our podcast today, to glean from the insights you've provided, to tap from even the success stories you've shared. But one important thing to call out is not all pregnancies will result in childbirth, and not all children are as a result of the IVF procedure. There are other options. It could be adoption, it could be surrogacy, just to mention a few. But as we work with our medical provider or fertility specialist, they would explore the options viable so that at least you can move forward with next steps, whatever that looks like. So on the last note, I think it's crucial to also repeat exactly what you said as well, that each person's journey is unique. So we shouldn't be comparing ourselves to
No.
that couple, or whatever. Some of the stories that you've shared, they highlight resilience, hope in the face of challenges. We will need that as women to have hope. And I sincerely wish those of us or you embarking on this journey the very best. Thank you so much, Dr. Martha, for sharing your time with us today and just helping us shed light on this very important topic. It's indeed helping to transform lives for the better. It's liberating, it's mind-blowing. So thank you for your time, Dr. Martha. Any last
You are more
words?
than welcome. More than welcome, and you are all welcome if you have, if you need or you want more information. Happy to carry on discussing with any one of you.
Thank you. Thank you so much for calling that out. So, dear listeners, women on the call, don't forget that knowledge empowers us to make informed decisions about our reproductive health. And it also helps to guide others, not just ourselves, along their own journeys as well. Thank you for listening to the Help We Need podcast. Stay tuned for more episodes on living your best lives. And until next time, stay empowered and remember to empower her.